Oh, hey there. Oh, hey there. Welcome to the wonderful world of anesthesiology.
Hey, I just met you, and this is crazy, but here's my number, so call me maybe. It's hard to look right at your baby.
Okay, I'm here with Dr. Jin, anesthesiologist of Western Medical Center in Santa Ana, and I'm here to ask you a few questions about anesthesia and what exactly you do. So question number 1, what is anesthesia?
Hi everybody, my name is Dr. Jin, and I've been practicing medicine for last 30 years. And the question, okay, what is the anesthesia? Basically, the anesthesia is it's simple. We're using the medicine, which is the chemical stuff, to put the patient to sleep. So during the surgery, which is cutting the patient, during the surgery, we provide best conditions so patient would not feel any pain. Without knowing anything, the surgery successfully done.
Question number 2, what is anesthesia made of?
Basically, the purpose of anesthesia is to put the patient to sleep, and second, the patient would not feel any pain, and number 3, patient is very well relaxed. Therefore, the medication we are using for anesthesia, or the medication, anesthetic medication, were made of, number 1, for sleeping medication, such as you guys probably already heard something like propofol, Michael Jackson. Okay, that's for sleeping part. And number 2, we are using some medication which is narcotics for pain control. Even if the patient is sleeping, the patient still feel pain. Therefore, we're giving some pain medication. Number 3, we are giving some muscle relaxant, relax the muscle, so the surgeon have a better condition to perform their surgery. Thank you.
Okay, now let's move on to question number 3. What are the side effects of anesthesia?
Okay, as I mentioned earlier, the medication is good to help patient to go through the surgery. However, unfortunately, any good medication always accompanied with side effect. Most side effects, as you guys probably already know, such like nausea, vomiting, and of course, if you use too much, we call it overdosed, then patient may die, just like Michael Jackson. Thank you.
This has been Dr. Jin, anesthesiologist of Western Medical Center, and enjoy the rest of the presentation.
Thank you.
Hi there. The tools used in administering anesthesia are:
Hey, I just met you, and this is crazy, but here's my number, so call me maybe. It's hard to look right.
continuous flow anesthetic machine. It's used to provide a measured and continuous supply of gases, for example oxygen, nitrous oxide, etc., mixed with a required concentration of anesthetic vapor to the patient at a required pressure and rate. Oxygen mask. It's used to deliver oxygen or to administer gaseous drugs. Endotracheal tube. A tube introduced into the patient's trachea to maintain a patient to ensure that air reaches the lungs for respiration. Laryngeal mask airway, also known as LMA. A less painful but less useful alternative to an endotracheal tube. Tracheostomy tube. It is a metal or plastic tube used to keep an artificial opening in front of the neck into the trachea opening to act as an alternative pathway for respiration. Endoscopes. It's used to look inside the esophagus, stomach, upper intestines, bile duct, larynx, trachea, and bronchi through the mouth. Filters. Used to filter out dust particles or certain gases from the gas being given to the patient. Needles. Used for injections, infusions, etc. Syringe. Used to inject drugs.
Hey, I just met you, and this is crazy.
Anesthesia dates back to the ancient Incas. Yep, the ancient Incas. That's chapter 11 for all you AP World History students. The ancient Incas used coked up chewing cocoa leaves mixed with saliva that they would spit into the holes drilled into the patient's heads. Then, in 1772, Joseph Priestley mixed all the gases that he discovered, which is like oxygen and nitrogen, and inhaled it and couldn't stop laughing. His discovery was eventually called laughing gas and was later improved by Humphrey Davy in order to use it as a pain reliever during medical surgeries. The first painless tooth extraction due to the use of laughing gas was performed in 1845 by Dr. Wells. This painless extraction was the gateway to the era of painless dentistry. The invention of anesthesia strong enough to perform painless surgery was never credited to anybody because everyone just expanded on the laughing gas that allowed painless dentistry. Also, the majority of inventors that contributed to the improvement of anesthesia could never be determined because most of them spent the rest of their lives getting high or stoned off of their innovations.